Skipping regular bathing might sound like a small mistake, but when it comes to older adults, it can have a surprisingly big impact on both personal hygiene and overall health. As people age, the body naturally goes through changes in skin texture, oil production, mobility, and even sense of smell. Many seniors may not realize how much sweat, oils, and dead skin cells accumulate on their body day after day, especially in areas like underarms, groin, behind the ears, or skin folds. This buildup provides the perfect environment for bacteria and fungi to thrive, and those microorganisms are the main cause of body odor. While younger people may sweat more actively, older adults often have drier skin but still shed layers of dead skin and produce natural oils. Without regular bathing, these elements mix with microbes and create a strong and unpleasant smell that can affect not just personal comfort but also social interactions and self-esteem. For many seniors, embarrassment about odor leads to isolation, avoiding family gatherings, or hesitating to join community activities, which then contributes to loneliness and even depression. Skipping bathing is also not just about odor, it carries hidden health risks. Sweat, dirt, and oil clog pores and irritate the skin, leading to itching, rashes, and infections. Seniors with reduced mobility or chronic illnesses like diabetes are at higher risk because their skin is more fragile and slower to heal. Unwashed skin can easily develop fungal infections such as athlete's foot, yeast infections, or ringworm, especially in warm, moist areas. These conditions spread quickly and can become very uncomfortable or even painful if left untreated. In addition, bed-bound seniors are those who sit for long periods in the same position face an increased chance of pressure sores if their skin is not kept clean and dry. The simple act of bathing removes bacteria, reduces friction, and keeps the skin healthier, lowering the risk of these dangerous sores that can take months to heal. Another factor is how bathing helps regulate temperature and blood circulation. A warm shower not only washes away dirt but also stimulates blood flow and relaxes stiff muscles. Many older people suffer from joint pain, arthritis, or muscle stiffness, and bathing can actually provide soothing relief. It becomes a form of therapy, promoting relaxation and even improving sleep quality. On the other hand, avoiding baths for long stretches can make muscles and joints feel more rigid, further reducing mobility and creating a cycle where bathing becomes even harder to do. In this way, what starts as a skipped shower due to fatigue or difficulty moving can eventually contribute to bigger physical and emotional problems. There's also the aspect of dignity and mental well-being. Cleanliness makes people feel fresh, confident, and cared for. Seniors who maintain good hygiene often feel younger, more energetic, and more socially open. But when bathing is neglected, seniors may feel ashamed of body odor, or others might avoid sitting close to them. That silent social rejection can deeply affect mental health, reinforcing feelings of being a burden. Family members sometimes struggle with how to politely address hygiene issues with their older loved ones, which can create tension. This is why regular bathing is not just a health measure but also a form of respect and self-care that preserves independence and self-worth. Practical barriers often explain why seniors skip bathing. Fear of falling in the shower, difficulty standing for long, or memory issues like dementia can make the simple act of washing overwhelming. Some seniors also have sensitive skin that reacts badly to frequent hot showers, so they reduce bathing to avoid irritation, not realizing that gentle alternatives exist. Caregivers and family members can help by ensuring the bathroom is safe with grab bars, non-slip mats, and a shower chair. Warm water, mild soap, and moisturizing lotion after bathing can protect sensitive skin. Even sponge baths on days when a full shower isn't possible can make a big difference. Establishing a routine, like setting a regular time of day for bathing, helps seniors remember and feel more comfortable with the habit. Ultimately, skipping regular bathing is not just about a smell problem, but about a whole chain of physical, emotional, and social consequences. Staying clean helps prevent infections, boosts circulation, supports mobility, reduces odor, and strengthens self-esteem. For seniors, every bath is more than just washing the body. It is refreshing the mind, preserving dignity, and protecting health. Families and caregivers need to understand that behind every skipped bath there may be reasons like fear, pain, forgetfulness, or depression, and addressing those issues with compassion is the key to encouraging better hygiene habits. By recognizing the importance of regular bathing, seniors can stay healthier, more confident, and more connected to the people around them. Poor oral hygiene in older adults is one of the most overlooked yet critical aspects of health, and its impact stretches far beyond just bad breath. As people age, the mouth undergoes many natural changes. Saliva production often decreases, gums may recede, teeth become weaker, and in many cases, dentures or implants are introduced. These changes make maintaining oral cleanliness even more essential, yet many seniors neglect it, either due to physical challenges, memory problems, or simply underestimating how important it really is. When daily brushing, flossing, and proper care of dentures are skipped, food particles, bacteria, and plaque begin to build up quickly. This not only leads to strong, unpleasant odors but also lays the foundation for infections, gum disease, tooth decay, and a cascade of other health issues that can spread far beyond the mouth. Bad breath, or halitosis, is often the first and most noticeable result of poor oral hygiene. For seniors, this can be socially isolating, making them hesitant to talk freely, smile, or engage with others. The shame of knowing one's breath smells unpleasant can cause embarrassment during family gatherings or public outings, leading to withdrawal and loneliness. But bad breath is only the surface symptom. Beneath it, plaque builds up on teeth and gums, creating the perfect breeding ground for bacteria. When plaque is not removed through regular brushing and flossing, it hardens into tartar, which can only be removed professionally. Tartar irritates the gums, triggering inflammation, swelling, and bleeding, a condition known as gingivitis. Left untreated, gingivitis can escalate to periodontitis, a severe gum disease that destroys the tissues and bones supporting the teeth, eventually causing teeth to loosen and fall out. Tooth loss in seniors is not just a cosmetic issue, it has a direct effect on nutrition and overall health. Without strong teeth, chewing becomes difficult, leading many older people to avoid hard, crunchy, or fibrous foods like fruits, vegetables, and nuts. Instead, they rely more on soft, processed foods that are easier to chew but often higher in sugar and lower in nutrition. This dietary shift can result in malnutrition, weight loss, or even worsen conditions like diabetes and heart disease. Moreover, infections in the mouth are not contained in the mouth alone. Research has shown a strong link between poor oral health and systemic illnesses such as cardiovascular disease, respiratory infections, and even cognitive decline. For example, bacteria from infected gums can enter the bloodstream, travel to the heart, and contribute to inflammation of blood vessels, raising the risk of heart attack or stroke. Similarly, inhaling bacteria-laden saliva due to poor oral hygiene can trigger pneumonia, a dangerous illness especially in seniors with weaker immune systems. Another overlooked aspect is denture care. Many older people wear partial or full dentures, and while these can restore function and appearance, they require daily cleaning. If dentures are not removed, brushed, and soaked regularly, food particles and bacteria accumulate on them, producing foul odor and increasing the risk of fungal infections like oral thrush. Ill-fitting dentures can also cause sores, ulcers, and pain, discouraging seniors from eating properly or smiling comfortably. Sometimes, seniors leave dentures in overnight or for days without cleaning due to forgetfulness or lack of awareness, which worsens these problems. Educating seniors about simple routines, like rinsing after meals, brushing dentures daily, and soaking them overnight in cleaning solutions, can drastically improve both hygiene and comfort. Dry mouth is another common issue that worsens with age, often caused by medications for conditions such as high blood pressure, diabetes, or depression. Saliva plays a key role in washing away bacteria, neutralizing acids, and keeping the mouth fresh. Without enough saliva, bacteria thrive, plaque builds up faster, and the risk of cavities increases significantly. Seniors with dry mouth often feel persistent bad taste, cracked lips, sore throat, and stronger bad breath. Simple solutions such as drinking more water, using sugar-free lozenges or mouth sprays, and avoiding alcohol-based mouthwashes can help manage dry mouth and keep oral hygiene under control. On the emotional and psychological level, oral hygiene is deeply tied to self-confidence. Seniors with stained teeth, missing teeth, or constant bad breath often feel unattractive and avoid smiling. This not only affects social interactions but can also contribute to depression. In cultures where family meals and conversations are central to bonding, being unable to enjoy food or fearing embarrassment can distance seniors from loved ones. Maintaining oral hygiene is therefore not just about physical health but also about preserving dignity, joy, and connection. Barriers to proper oral care are real for older adults. Arthritis or hand tremors can make brushing and flossing difficult. Cognitive issues like dementia can cause forgetfulness about daily routines. Financial struggles may prevent regular dental checkups, especially when dental insurance is limited. These challenges mean that caregivers and family members often need to step in, offering support through reminders, providing adaptive toothbrushes with larger handles, scheduling regular dentist visits, or helping with denture cleaning. Encouraging seniors to view oral hygiene as a non-negotiable part of daily life is essential, just like eating or bathing. Ultimately, neglecting oral hygiene is like opening the door to a range of avoidable health and social problems. The mouth is the gateway to the body, and if it is not kept clean, bacteria and infections will spread, damaging not just teeth and gums but also the heart, lungs, and overall quality of life. A clean, fresh mouth allows seniors to eat well, speak clearly, smile confidently, and interact socially without fear or shame. It supports better nutrition, lowers the risk of serious illnesses, and strengthens mental well-being. For older people, good oral hygiene is not a cosmetic luxury but a crucial foundation of health, dignity, and happiness. Every brush, every rinse, and every dental visit is an investment not only in a fresh smile but in a longer, healthier, and more fulfilling life. Unwashed clothes and bedding are one of the most underestimated hygiene mistakes that can seriously affect the health and comfort of older adults. Many seniors believe that if they don't sweat much or if their clothes look clean, then reusing them multiple times is harmless. However, even when there are no visible stains or dirt, fabrics trap sweat, skin flakes, body oils, food particles, and environmental dust. With time, these materials turn into a breeding ground for bacteria, fungi, and even dust mites. For younger people with stronger immune systems, this buildup might only cause minor irritation or odor, but for older adults with weaker defenses, it can contribute to persistent infections, skin rashes, respiratory issues, and unpleasant smells that affect daily life. Clothes and bedding are in direct contact with the skin for hours, and neglecting to keep them clean means prolonging exposure to harmful microbes that multiply quickly in warm, moist environments like sheets, pillowcases, socks, or undergarments. The first and most noticeable consequence of not washing clothes and bedding regularly is odor. Clothes that are worn repeatedly without cleaning develop a stale smell caused by bacteria breaking down sweat and oils. This odor clings to the body and becomes difficult to mask with perfumes or deodorants. Bedding, especially pillowcases and sheets, absorbs sweat, saliva, and oils every night, which leads to a musty or sour smell. For seniors, who may already struggle with body odor due to changes in skin and metabolism, dirty fabrics intensify the problem. Beyond odor, dirty fabrics create constant skin contact with bacteria and fungi, which increases the chances of irritation, itching, and infections. Older adults often have thinner, more fragile skin that breaks down easily, making them more vulnerable to fungal infections like ringworm, yeast growth in skin folds, and bacterial infections that can quickly spread. Respiratory health is another major area affected by unwashed fabrics. Bedding that is not washed frequently accumulates dust mites, microscopic organisms that feed on dead skin cells. Dust mites thrive in mattresses, pillows, and blankets, releasing waste particles that can trigger allergies and breathing problems. For seniors with asthma, chronic obstructive pulmonary disease (COPD), or weakened lungs, sleeping on unwashed bedding can worsen coughing, wheezing, and congestion. In addition, mold can develop in bedding or clothing stored in humid areas, and breathing in mold spores can be extremely harmful to elderly individuals with compromised immune systems. Fresh bedding, washed and dried properly, not only reduces exposure to allergens but also promotes better sleep quality, which is crucial for senior health. Another overlooked issue is the psychological impact of wearing dirty clothes or sleeping in unclean bedding. Clean fabrics provide a sense of freshness, dignity, and self-respect. On the other hand, seniors who repeatedly wear unwashed clothes may feel embarrassed if others notice the odor, leading them to withdraw socially. Family members or caregivers may hesitate to mention the problem directly, but the discomfort is often obvious. This silent social distancing can hurt the emotional well-being of older people, who may already be struggling with loneliness. Something as simple as putting on freshly laundered clothes or sleeping on clean sheets can improve mood, boost confidence, and restore a sense of normalcy and pride. Neglecting laundry is often not a deliberate choice but a result of challenges faced by seniors. Physical limitations such as arthritis, back pain, or reduced stamina can make carrying laundry baskets, bending to load machines, or hanging clothes extremely difficult. Cognitive issues like memory loss or dementia may cause seniors to forget how long it has been since clothes or bedding were last washed. Financial constraints may also discourage frequent laundering, as some older adults try to save money on water, electricity, or detergent. For those living alone, the effort of doing laundry may feel overwhelming, leading to avoidance. These barriers mean that caregivers and family support become essential in ensuring regular washing routines are maintained. Establishing a simple laundry schedule is one of the easiest ways to prevent problems. For example, undergarments and socks should ideally be washed after every use, while shirts and pants should be washed after 1 or 2 wears, depending on the level of activity. Bedding should be washed at least once a week to minimize bacteria, allergens, and sweat buildup. Towels, which retain moisture, should also be washed frequently to avoid mildew. Using mild, fragrance-free detergents can protect sensitive skin, while ensuring clothes and bedding are completely dried before use prevents mold growth. For seniors unable to manage these tasks independently, caregivers can help by simplifying laundry routines, using smaller loads, or arranging for laundry services. Another factor to consider is that fabrics in direct contact with wounds, medical devices, or incontinence issues need extra attention. Seniors who wear adult diapers or use incontinence pads must change clothes and bedding more often, as urine or feces left in fabric can cause strong odor, painful skin rashes, and dangerous infections. In such cases, prompt laundering is not only about comfort but also about preventing serious health complications. Using waterproof mattress covers, absorbent bed pads, and easy-to-wash fabrics can reduce the effort needed while still maintaining cleanliness. There is also a clear link between fabric hygiene and quality of sleep. Climbing into a bed with clean, crisp sheets feels refreshing and encourages relaxation, while stale, unwashed bedding can feel uncomfortable and even disrupt sleep. Poor sleep affects mood, memory, and physical health, all of which are especially important for seniors. Studies show that fresh sheets contribute to better rest, which in turn boosts immune function, energy levels, and overall well-being. Something as simple as clean bedding can therefore have a ripple effect on nearly every aspect of health. Ultimately, unwashed clothes and bedding are not just a cosmetic or odor issue, they are a serious health risk for older adults. Dirty fabrics harbor bacteria, fungi, dust mites, and mold, all of which can irritate skin, worsen breathing, and lower immunity. The emotional toll of odor and uncleanliness further adds to feelings of isolation or depression. By prioritizing laundry as part of senior hygiene, families and caregivers can protect not just health but also confidence and dignity. Clean clothes and bedding symbolize self-care, freshness, and vitality, reminding older adults that they deserve comfort and respect in their daily lives. Regular washing is therefore more than a chore. It is an essential pillar of maintaining both physical and emotional well-being as one grows older. Neglecting foot and incontinence care is one of the most damaging hygiene mistakes older adults can make, not only because of the odor it produces but also because of the serious health complications it invites. Feet carry the body's weight every day, and for seniors who may already struggle with circulation problems, diabetes, or mobility issues, neglecting foot hygiene can quickly spiral into infections, pain, and even loss of mobility. Likewise, incontinence, which is common among the elderly, due to weakened bladder muscles, prostate problems, or certain medications, requires consistent and proper hygiene. Ignoring it can cause strong, lingering odors, skin irritation, urinary tract infections, and in severe cases, more serious illnesses. Together, these two areas of care, feet and incontinence, are essential for maintaining dignity, comfort, and overall health in older adults. Feet are particularly vulnerable in seniors because of changes that occur with aging. Skin on the feet becomes thinner, less elastic, and more prone to cracking. Toenails grow thicker and harder to trim, and circulation to the extremities often weakens, especially in people with diabetes or cardiovascular problems. When feet are not washed regularly, sweat, bacteria, and fungus collect in socks and shoes, leading to odors and infections like athlete's foot. Fungal infections thrive in moist environments, and feet provide exactly that, especially when seniors wear the same socks or shoes for long periods without washing or airing them. Neglected toenails can also become ingrown or infected, causing pain that makes walking difficult. For seniors already at risk of falls, painful or infected feet further increase the danger by discouraging steady walking or causing imbalance. Another overlooked aspect of foot care is the risk of ulcers and sores. In older people with diabetes, poor circulation and nerve damage neuropathy mean that small cuts or blisters on the feet can go unnoticed. Without daily cleaning and inspection, these minor injuries can turn into serious ulcers that are extremely difficult to heal. Infections in the feet, if left untreated, can spread quickly and in severe cases even lead to amputations. Something as simple as washing feet daily, drying them thoroughly, especially between the toes, and applying moisturizer to prevent cracks can drastically reduce these risks. Regular nail trimming, wearing clean cotton socks, and using breathable footwear also help prevent fungal and bacterial growth. Professional podiatry visits are especially important for seniors with diabetes, but many skip them, leading to avoidable complications. Incontinence, on the other hand, brings its own set of challenges. Many older adults experience some degree of urinary or fecal incontinence, but because it is often embarrassing to talk about, it is neglected. When proper hygiene is not maintained, accidents lead to lingering odors that can cling to clothes, bedding, and even furniture. But more importantly, contact with urine or feces irritates the skin, causing redness, rashes, and painful sores. Prolonged exposure can break down the skin, leaving it open to bacterial infections. Seniors who wear adult diapers but do not change them frequently are at particular risk of developing painful conditions like diaper rash, pressure ulcers, or urinary tract infections. These infections can travel to the kidneys or bloodstream, becoming life-threatening if untreated. The psychological impact of neglecting incontinence care is enormous. Older adults who struggle with leaks may feel ashamed or anxious, fearing that others will notice the smell or stains. This often leads to social withdrawal, reluctance to leave the house, and even depression. In many cases, seniors refuse to admit they have incontinence issues because of stigma, which only worsens the problem. Proper hygiene, frequent washing of the body, immediate changing of soiled clothes, and use of absorbent products can restore dignity and give seniors confidence to participate in social activities without fear. Families and caregivers need to approach this subject with compassion, encouraging open discussion and offering discreet solutions rather than criticism or shame. Another complication is the way foot and incontinence issues interact with each other. Seniors who are less mobile because of foot pain or infections may have more difficulty getting to the bathroom in time, increasing incontinence accidents. Conversely, seniors who experience frequent accidents may develop skin infections on their feet or legs if they are not cleaned promptly. In both cases, hygiene neglect creates a cycle of worsening health and reduced independence. Breaking this cycle requires proactive care, making bathrooms easily accessible, providing supportive footwear, using absorbent pads or protective bedding, and ensuring daily washing routines are followed. From a caregiver's perspective, neglect in these areas often happens because of time, effort, or discomfort. Washing and drying an older person's feet requires patience and gentle handling, especially if they have sensitive skin or limited mobility. Incontinence care can be emotionally challenging for both the senior and caregiver, as it involves intimate assistance. However, ignoring these tasks leads to much bigger health problems, hospital visits, and costs in the long run. Building routines, using protective gloves, and incorporating dignity-preserving products such as odor-neutralizing sprays, adult wipes, and discreet diapers can make care easier and more effective. Foot hygiene and incontinence management also tie directly into overall quality of life. Clean, healthy feet mean seniors can walk more comfortably, stay active, and avoid being bedridden. Active seniors maintain stronger muscles, better circulation, and sharper mental health. Likewise, managing incontinence properly means seniors can leave the house without fear, sleep more comfortably, and interact with loved ones confidently. Both contribute to a sense of independence, which is vital for mental and emotional well-being. In addition, good hygiene practices in these areas help prevent secondary problems. For example, seniors who suffer from untreated foot odor or incontinence odor may experience tension with family members or caregivers. Bad smells in shared living spaces can create frustration, embarrassment, and even conflict. On the other hand, when proper care is given, not only does the senior feel better, but the home environment becomes more pleasant for everyone involved. This fosters stronger family relationships and a more supportive atmosphere. Ultimately, neglecting foot and incontinence care is not a minor oversight but a major threat to senior health, comfort, and dignity. Clean feet reduce the risk of fungal infections, ulcers, and mobility issues, while proper incontinence care prevents skin breakdown, infections, and social embarrassment. Both are deeply connected to the physical and emotional well-being of older adults. By making these areas a priority, seniors can maintain healthier bodies, more confident social lives, and a higher quality of life overall. The key is consistency, compassion, and awareness, simple daily care that protects against some of the most damaging but preventable problems seniors face as they age.